optimization from testing and commissioning, which means if let's say we say the laser is supposed to have a 20-watt output, we do the consistency checking and cross-checking with our technology as well, and also our clinical team where we ensure the consistency of the practice itself, and then how we come to our end users, which are our clients and our patients and as well, right? And these are our 3 state of art. We specialize in physiotherapy, cardiology, and aesthetics. These are the products that we actually specialize in. And these are the range of products that we have for physiotherapy. We have focus shockwave, we have radial shockwave, we have lasers, we have spinal decon, TR therapy, superinductive system, which is the topic today, and the basic combination. I will just go through briefly about the products that we have. These are the high-end technology that rehabilitation has revolutionized. Okay, basically we have laser, high-intensity laser, which is with robotic arm. We have focus shockwave, we have SIS, RFOS, PR, and Stella, spinal decon, and RGate. Just superinductive system. This is mainly used for pain relief, joint mobilization, fracture healing, myostimulation, and spasticity reduction. I won't touch so much about regarding this because I have my product specialist and the whole team going to talk about this. And then we do have TR therapy. It's using radio frequency current where it incorporates your manual skill and it has a tissue selectivity heating mechanism. So it works a lot for trigger points, muscle regeneration, and post-traumatic edema. And these are the applicator that is quite comfortable, which is fit for any hand grip. And these are the techniques that we use when using TR therapy. You can use massage technique, passive technique, muscle activation technique, and it has unlimited penetration of depth of energy. So it's producing radio frequency current. At the same time, you will have some thermic current as well. We have 2 applicators. One is called capacity, where it covers more of the muscle impedance for lower muscle impedance, which is like muscle bulk. And then we have the resistive mode, which works for deeper tissues like joint, like ligament and tendon and joint. Yeah. And basically the thermic effect in a glance, it relaxes the muscle, it produces tissue regeneration, and improves range of motion. And this will relieve pain. Yeah, next. And we do have high intensity laser with the robotic arm. So I think you all are familiar with the lasers, but here we do have the robotic arm where it actually does the job for you, which is simulating just like how humans are doing it. So it is operator free, and the mechanism is the same. It goes on absorption manner, where the light therapy absorbs to the cellular level. It will activate the mitochondria, it will produce more ATP, and this will accelerate the healing process. And this does pain relief, thermic effect, biostimulation, and anti-inflammatory effect. And we do have shockwave. Shockwave works for chronic tendinopathies. I think we are also familiar with the shockwave energy. It's using the mechanical stimulation with a sound wave, and these will produce our own body healing process. Yeah, and it works for chronic tendinopathies, calcification, bone non-unions, chronic pain as well. And we do have a new technology for shockwave, which is, we call it Magna, shockwave Magna. It goes up to 6 bar and it carries up to 22 hertz of frequency. And then shockwaves, yes, it crosses cell stimulation and growth factor, and this will create tissue regeneration. And we do have VTL spinal decompression. This is quite advanced version of traction for all level of spine. It is a non-invasive alternative to spine surgery. It can do a lot of positioning, and this is the very first automated decompression for neck pain that substitutes manual therapy as well. So what it comprises, the positioning as well, and causing distraction and mobilization. Yeah, these are the certain positions that you can apply for lower back pain, the positioning in all angle, prone lying, supine lying, sorry, and then you can have side lying, and as well as and supine and prone lying as well. And this is used for cervical traction. And these are other positions that you can do. This is also our new advanced technology that we have come up with. This is just a glance, a short video to show how it works. And then we do have men's and women's health area as well. One is focused shockwave for urology. This we use for ED, and chronic pelvic pain syndrome, and it can be used with Peyronie disease. What's the advantage with this focus shockwave? We do have a special coupling pad that customizing the shape of the covering this area as well. So what it does, the acoustic wave penetrates tissue and it promotes cell growth as well. So it improves blood circulation, neovascularization, and pain relief, and reduction of chronic inflammation. And we do have BTL Amsella, and Amsella is a chair. We have this amazing chair that all you need to do is just sit on the chair and get your pelvic floor muscles stimulated. This is used for incontinence and intimate wellness as well. We do have some protocol for this. And if you notice, these images, before and after, how the pelvic floor muscle is below the bladder, and how this has been elevated after the treatment. Yeah? This is a short video how it works. All they need to do is sit on the chair for 28 minutes and get their pelvic floor muscle strengthened. It is stimulating almost 11,000 Kegel exercise stimulation, pelvic contraction as well. All right. And then this is another new technology that we have. It's called BTR R-Force, which is anti-gravity treadmill. So it's used for stroke and neurodegenerative diseases. You can use for patients with injuries of post-surgical conditions, sports injuries, and also for training purposes. And this, you can go 100% of your body weight, which means you are not going to put any load on your joint, and you can also progressively increase, which means you can have it from 90%, 80%, 70%, you can decrease gradually. So it is very ideal for patients with knee pain, ankle pain. You want to train them for gait training, you can actually start with this. Yeah? And how it works, it increases the internal pressure. So basically there is air. They are running, almost simulating something like running in the swimming pool. Yeah? This is a short video, how it works. To activate the patients to be motivated to run or walk or practice starting to walk again. So it's very ideal for patients who are geriatric as well. So patients who are big, because we do have the pants that comes in all level of sizes. Yes. And this is another product that we have. It's called BTL Arcade, used for stroke. It's more for CP kind of patients. And we do have flexible foot plates, and which comes with 8 pressure sensors and haptic feedback. It has dynamic body weight support. It's used for even adult adult, pediatrics patients, and also geriatric patients as well. And we do have this gaming module to motivate the patients with CP especially. So you can see we can cover most all kind of patients who are overweight, pediatrics, and also who are normal, which is CP kind of patients, stroke patients. This is our latest technology. We do have VTL cryotherapy. What is different is it is hands-free experience where you produce. We have sleeves for the icing to create the cryotherapy. Yes, it reduces pain perception and it works on cold blocking the skin, nociceptors and nerve transmission. And you can have for lower body, upper body, for shoulders. So we do have these applicators for all level kind of body segment. Right? And other supporting modalities, we have traction, we have lateral therapy, we do have hands-free ultrasound, we also have low-level laser. And these are other things. We have lymphostim. This is used for patients with lymphedema cases. I think you have come across patients with very swelling kind of legs, and then patient with post-mastectomy after removal of their breast, and you can see the arm is swelling. We do have an arm applicator as well. We do have a lot of patients who are having this for their home use because doing lymphatic drainage is not an easy mechanism, but this is MDA certified, and also we do have certain protocols that actually suit this kind of patients. Yeah, and also we do have CPM and cultures. We do have R&D centers around the world. What is the advantage of these? If let's say you have any feedback regarding our devices, we do actually bring back to our HQ. We always improvise on protocols, on the software, and all the hardware as well. But yes, based on your feedback. Yeah? We did receive some award for our design. And we do have production facilities in Europe. So we do have a manufacturing facilities in Europe that only then it comes to Malaysia. And from HQ, we deliver to our clients. Yeah? And who else trusts us? This is internationally. We do have a lot of football clubs trusting us. And this is just one example. I think, are you all a football fan or not? No? Okay, but yeah, let me show you. This is with Brazil. You all know him? Our basic electrotherapy. This is later I think you all will have more idea regarding this technology. And yes, we do work with great clients even locally. We do have some group of hospitals like you all, our personal clients who really support us a lot. We really thank you all for all the support. And we did receive some award and recognition internationally. And basically that's it. Thank you from my side. Next I will introduce Ms. Vaini, who's my product specialist. She's going to talk more on SIS, the technology behind it, what it does, and then the principle behind this superinductive systems technology.
Hello everyone, good morning. Thank you so much for coming. So huge, I mean like from Penang, I think after a long time we are doing a workshop. I think after pandemic, this is after pandemic, we are doing a physical workshop actually. So I introduce myself first. So myself, I'm Vaini. I'm a product specialist for PPL. So for all the machines, you will see me for the CME training and everything. Okay. So today, yes, we are here because of super inductive system. So we brought our machine here. At the same time, we have a speaker like who are using it also. They are our clients who are using it. So we call them as a speaker for introducing, like to talk about the SIS also. From my side, I will talk about the clinical background, and also I would like to introduce the mechanism behind the superinductive system. Okay, so in between we can have it as an interaction session as well. So in between, if you all have any question, you can always stop me to ask questions. Okay, so to make it a bit more interactive, I have videos also for you guys. Okay, so let's start with it first. Okay. Alright, so yes, so it's actually a new perspective in a clinical, basically. So like, next slide. Okay, so what is superinductive system? Okay, superinductive system is actually using an electromagnetic field. Alright, the background that, like medical background behind it is actually, we are using an electromagnetic field. And how does it like work in our tissue? It actually depolarizes the neuromuscular tissue in our body. Okay, so when it comes to the parameters, right, like any other machines, we have parameters like the intensity, frequency, and everything, right? So particularly in medial superinductive system, we are using the power of electromagnetic field, which is up to 2.5 Tesla power. All right, and what actually gives you a different type of therapeutic effect is actually the various range, the wide range of the frequency, which is from 0 to 150 Hz actually. Alright, so we will go further, in details in other slides. Okay, so this is a bit of physics. I know like not all of us like physics, okay, as a physios and medical practitioner, but this is a very general thing. As you can see here, this is showing about the applicator. As you can see here, this is actually the coil which is in the applicator, which is this part here. Alright, so how does it work? Okay, I think you can see the thumb direction, right? So actually the thumb direction, the thumb upward is actually the current direction. And what shows, it's on the right thumb, so what shows the fingers is actually the coil form of the electromagnetic field, alright? Next. Okay, so here I would like to show you a video, alright? How does it actually works on the iron filling, alright? The electromagnetic field, how does it work on the iron filling? But before that, I would like to show you this picture. It shows like horizontally you can see it's 9 cm, and also when you see the penetration level is about 10 cm. So what does it mean is actually when the penetration like goes deeper to our tissue, right, it will actually go into a cone shape. Okay, and also it actually a wide range, so it can also cover a larger area as well. Okay, okay, as you can see, that is actually like how the electromagnetic field inducing the iron filling. So this is actually without actually touching the iron filling. You can see a gap, right, in between. So this is how it actually does some changes in our tissue as well. But how does it does some changes in our tissue? Next. Okay, so basically when it comes to our tissue, right, it will actually does some changes in your neuromuscular tissue, where it actually depolarize and repolarize your nervous system. Alright. From there, it actually increases the action potential and causing like contraction and also relaxation of your muscle. So this is the like tissue changes that happen when we apply the electromagnetic field into our tissue. So here, where are other fields that we can see EMF? Okay. So the first one I would like to show about the MRI. So even in MRI, they are using electromagnetic field. But what is the difference in MRI and our superinductive system? Of course, we are using in radiological purposes when it comes to MRI. And then the power that we are using for MRI is about 1.5 to 7 Tesla power. Alright? And the waveform that we use for MRI is actually a continuous waveform. Alright? And also, when it comes to the phase, right, the polarity, right, there will be a negative and positive polarity when it comes to the MRI. When it comes to the second one, this is the second example. Another field where they are using EMF is actually transcranial magnetic stimulation. This is more on the brain stimulation. Patients with psychological issues like mental disorders and all, like schizophrenia, all those cases they can actually use the TMS. So for this particular like TMS, right, they're using the power of 2 Tesla power, up to 2 Tesla power. Alright. The next one is traditional rehabilitation. So where you can see some milli-Tesla power. Alright? They're using EMF also, but they're using it in a milli-Tesla power where the power is very, very minimum. Okay? So they're using like 1 to 50 milli-Tesla power. Alright? So how do we like actually like calculate it? Alright? Let's say you're using like 1000 milli-Tesla is equivalent to 1 Tesla. So this is how we calculate it. Okay? So the next one. Alright. So here I would like to actually show the FDA approved for our SIS. FDA is actually basically the US. Alright. Usually to get the FDA approval for a machine is not easy. Like here we have MDA, right? So just like in US, because our machine is from Europe as well. So without getting the FDA approval for the certain indications, right, it's not easy to get into the market. So in Malaysia, yes, we have the MDA approval basically. So all our machine, especially for superinductive system also, we are actually like MDA approval. Alright? And also, what are the indications that we can actually use superinductive system? As per the FDA approval, it can actually use for relaxation of the muscle spasm and then prevention or retardation of the atrophy, tissue atrophy, increasing blood circulation, muscle re-education, immediate post-stimulation, post-surgical stimulation of calf and prevent the venous thrombosis, and maintaining